From the moment you begin hoping for a pregnancy, something changes. You start noticing your body in a way you never did before. A slight sensation, a subtle shift, a small difference, suddenly everything feels meaningful. That waiting period before your expected cycle can feel longer than it actually is, filled with questions and quiet anticipation. What many women don't realize is that the body often begins signaling these changes earlier than expected. Long before a missed period, there are subtle clues that something new may already be happening. In this video, we'll walk through 10 early signs that may appear sooner than you think, helping you better understand what your body could be trying to tell you. Hey there, future mamas! Are you trying to conceive and finding yourself analyzing every little change in your body? You're not alone. Many women who are hoping to become pregnant are eager to spot the earliest signs of pregnancy even before a missed period. While the only definitive way to confirm pregnancy is through a test, several common symptoms may indicate your body is undergoing the incredible transformation of early pregnancy. In this video, we'll explore the top 10 early signs of pregnancy you might experience before you even realize your period is late. These subtle changes can be the first clue that you've got a little one on the way. So, whether you're actively trying to conceive or just curious about the early signs of pregnancy, keep watching to learn more about what to look out for. Before we get started, hit that like button and subscribe to our channel for more pregnancy and motherhood content. We have tons of helpful videos to guide you through this exciting journey. When you're actively trying to get pregnant, the 2-week wait between ovulation and your expected period can feel like an eternity. You might find yourself overanalyzing every little twinge and change in your body, wondering if it could be a sign of early pregnancy. While the only surefire way to know is to take a pregnancy test, there are some common symptoms that many women experience before they even miss their period. 1. Implantation bleeding. One of the earliest signs of pregnancy is implantation bleeding, which occurs when the fertilized egg attaches itself to the lining of the uterus. This can happen anywhere from 6 to 12 days after conception and is usually much lighter than a regular period. Implantation bleeding may appear as light spotting or a pinkish discharge, typically lasting only a day or two. Some women may mistake this for an early period, but there are a few key differences. Implantation bleeding is usually lighter in color and flow than menstrual blood and doesn't follow the same pattern as a regular period. If you experience light bleeding around the time of your expected period and it doesn't progress into a full flow, it could be a sign of early pregnancy. However, not all women experience implantation bleeding, so its absence doesn't necessarily mean you're not pregnant. 2. Tender, swollen breasts. Another common early sign of pregnancy is changes in your breasts. As your body prepares to support a growing baby, hormonal shifts can cause your breasts to become tender, swollen, and heavy. You may notice that your breasts feel more sensitive to touch or that your nipples become darker in color and more pronounced. These changes are caused by the increased production of estrogen and progesterone, which stimulate the growth of milk ducts and prepare your breasts for eventual breastfeeding. Some women describe the sensation as a feeling of fullness or heaviness, similar to how breasts might feel before a menstrual period but more intense. If you're experiencing breast changes and suspect you might be pregnant, it's a good idea to invest in a supportive bra to help alleviate any discomfort. 3. Fatigue. Feeling exhausted, even after a good night's sleep, is another common early pregnancy symptom. As your body works hard to support the growing embryo, you may feel more tired than usual. This fatigue is caused by the increased production of the hormone progesterone, which can make you sleepy and sluggish. In early pregnancy, your body also produces more blood to support the developing placenta, which can contribute to feelings of fatigue. Many women describe pregnancy fatigue as a constant state of exhaustion, making it difficult to carry out daily activities. If you're usually energetic and suddenly find yourself needing naps or struggling to stay awake during the day, it could be a sign that you're pregnant. 4. Nausea. Perhaps one of the most well-known pregnancy symptoms is nausea, often referred to as morning sickness. Despite its name, morning sickness can strike at any time of day and may begin as early as 2 weeks after conception. This symptom is caused by the rapid rise in the hormone human chorionic gonadotropin, HCG, which is produced by the developing placenta. Nausea during pregnancy can range from mild queasiness to severe vomiting and can be triggered by certain smells, foods, or even an empty stomach. Some women find that eating small, frequent meals and avoiding strong odors can help alleviate nausea. Ginger, whether in tea, candies, or supplements, has also been shown to help reduce pregnancy-related nausea. If you're experiencing severe nausea and vomiting that prevents you from keeping down food and fluids, be sure to contact your healthcare provider. 5. Heightened sense of smell. Early pregnancy can cause a heightened sense of smell, making previously mild odors seem overwhelming or even revolting. This symptom is thought to be related to the increased estrogen levels in the body during pregnancy. You may find that certain smells, such as perfumes, food, or even your partner's body odor, become more intense or off-putting. This heightened sense of smell can also contribute to nausea and food aversions. If you're suddenly more sensitive to smells and are experiencing other early pregnancy symptoms, it could be a sign that you're expecting. 6. Frequent urination. As your body produces more blood and fluids to support the growing embryo, you may find yourself needing to urinate more frequently. This increased urination is also caused by the hormone HCG, which stimulates blood flow to the pelvic area and can make you feel the need to urinate more often. Further, as your uterus begins to grow, it can put pressure on your bladder, leading to more frequent trips to the bathroom. 7. Mood swings. Hormonal fluctuations during early pregnancy can cause mood swings, leaving you feeling emotional, irritable, or even anxious. These mood changes are caused by the rapid shifts in estrogen and progesterone levels, which can affect neurotransmitters, the chemicals in your brain that regulate mood. You may feel more sensitive than usual, crying over small things, or experiencing sudden bursts of joy or frustration. If you're noticing changes in your mood and are experiencing other early pregnancy symptoms, it could be a sign that you're expecting. Remember to be gentle with yourself and practice self-care during this time. 8. Food cravings or aversions. Early pregnancy can cause changes in your taste preferences, leading to sudden cravings or aversions to certain foods. These changes are related to hormonal shifts in the body, which can alter your sense of taste and smell. You may find yourself craving specific foods, such as salty or sour snacks, or feeling repulsed by foods you normally enjoy. Food aversions are particularly common in the first trimester and can be triggered by the smell, taste, or thought of certain foods. 9. Implantation cramping. Some women may experience mild cramping or a pulling sensation in their lower abdomen around the time of implantation. This sensation is caused by the fertilized egg attaching itself to the lining of the uterus and can feel similar to menstrual cramps, although usually milder and shorter in duration. Implantation cramping typically occurs around 6 to 12 days after conception and may be accompanied by implantation bleeding. If you're experiencing mild cramping around the time of your expected period and it doesn't progress into a full menstrual flow, it could be a sign of early pregnancy. 10. Missed period. The most well-known sign of pregnancy is a missed period. If you have a regular menstrual cycle and your period is more than a week late, it's a good idea to take a pregnancy test. However, it's important to note that not all missed periods are caused by pregnancy. Stress, changes in weight, hormonal imbalances, and certain medications can also cause a delay in menstruation. If you've missed a period and are experiencing other early pregnancy symptoms, it's best to confirm your pregnancy with a test or by consulting your healthcare provider.